magpa-res bakuna ako para may dagdag protection mula sa COVID-19. Lalo na ngayon, dapat umiwas sa malubhang kaso nito.
At dahil kailangan kumayod para sa pamilya, dapat bawas pangamba saan man pumunta.
Kasama ng mask, hugas at iwas, mas protektado tayo pag may res bakuna.
Napatunayang ligtas at mabisa ang res bakuna. Kaya buong pamilya ko, naka 2 doses na. Libre lang to. Pumunta sa inyong health center o tumawag sa DOH 1555 hotline.
Dear God, thank you for the opportunity to meet together. Please help us to come together to make this institution reflect your kingdom. Breathe life into our ideas and decisions. Help us build a team that has love and respect at its heart. Give us the strength to continue working for your kingdom in this time of pandemic. Lord, come give us the inspiration to be the best we can be. May we be a shining example of your goodness and truth within, wherever we are. Inspire our thoughts, discussions, and ideas, and continue to remind us that all that we do here today, all that we accomplish, is for the pursuit of truth for the greater glory of you. We ask these things in your name. Amen. Dear God,
Good afternoon, everyone. Magandang hapon po to all of our healthcare workers who dedicated time this afternoon to join us in this town hall session where we hope to discuss updates in our PDITR guidelines. PDITR meaning prevent, detect, isolate, treat, and reintegrate, which is the government's main strategy in combating COVID-19. Before we begin, I'd just like to acknowledge the many healthcare workers who have worked tirelessly the last 2 years during the pandemic, and most especially in these most difficult time during this post-holiday increase in cases. Today, we have a very concise presentation for all of you, beginning with a presentation by Yusek Vergere, and it will be followed by an open forum wherein all of you will be able to ask questions to our technical advisory group, which consists of our 3 experts, Dr. Marisa Alejandria, Dr. Ana Ong Lim, and Dr. Edsel Salvania. So during the course of Yusek Vergere's presentation, we encourage everyone to type your questions into the chat box. And in case that we will be having more participants and we will not be able to accommodate you in this Zoom link, this event is also live on the DOH Facebook page. Our team will also be getting some questions from health workers posted on our Facebook page. So without further ado, we're now welcoming Yusek Maria Rosario Vergere, who is our Undersecretary for Health in the Public Health Services team, and she will be presenting to everyone the proposed changes in our PDITR guidelines. Yusek, over to you po.
Thank you, Director Bev. Magandang hapon po sa inyong lahat, sa ating mga healthcare workers. Magandang hapon po. We are now joined, as what Director Bev has mentioned, by our experts from our TAG experts, Dr. Edsel, Dr. Isa Alejandria, and Dr. Ana Ong Lim. Together with me also, of course, the whole DOH team, headed by Director Bev, Director Nika Hao, and Director Thea de Guzman. So for today, we are going to present upcoming policy updates in terms of protocols for quarantine, isolation, and testing. Can we have the slides now? Next slide, please. Next slide. Before going to the guidelines, let me share a brief situationer, especially with what we have seen for Omicron in the National Capital Region. In the past weeks, we see that the current picture of our epidemic curve is indicative of the transmission pattern of the Omicron variant. But we have to take note that our genome sequencing still shows that the Delta variant is still circulating. Between the onsets of the Delta and the holiday increase in cases, can we have the next slide, please? Between the onsets of the Delta and the holiday increase in cases, the National Capital Region had a larger increase in vaccination rates compared to other parts of the country. We would like to thank everyone who got inoculated during the National Vaccination Days last November 29 to December 1 and December 15 to December 22. We would also like to extend our gratitude to all of you, our healthcare workers, for making the inoculation of vaccines faster. Next slide. At present, the National Capital Region cases are now 60% less likely to be hospitalized compared to non-NCR cases. This was seen as more evident during this holiday season. Next slide. We also see the phenomenon of decoupling in the National Capital Region. This is when increase in cases do not translate to the same increase in proportion of severe and critical cases. Similar to the situation in other countries with Omicron, this is also signaling to us that our vaccine and our current standards protects the population against severe disease and death. Next slide. We can also see that in terms of percentage, the proportion of severe and critical cases had been decreasing even with the rise in the number of cases, and the proportion of mild and asymptomatic cases had been increasing instead. Next slide. In the National Capital Region, possibly because of high vaccination rates, we are also seeing two types of COVID-19 patients. Patients admitted for COVID-19 and patients admitted for other conditions but tested positive on admission or an incidental finding. For those admitted because of COVID-19, the usual presentation is pneumonia. And for incidental COVID-19, those who were admitted for other health conditions like acute appendicitis, heart conditions such as acute coronary syndrome and CVD infarct, or even trauma, they tested positive for COVID-19 upon admission. Next slide. Data from the sentinel sites like the Philippine General Hospital also shows this shift in pattern from primary COVID to incidental COVID. During the Delta situation last September, majority of admissions are primarily due to COVID-19. And this is our graph or the pie chart on the left side. And now, with this situation that we have right now, the pattern has significantly shifted to a bigger proportion of patients now are incidental COVID-19. On the right, you'd see the pie chart wherein 88.7% right now from December 25 to January 7 are incidental COVID-19 cases. Next slide. This is a similar pattern we had been seeing from our DOH NCR hospitals, wherein more COVID-19 patients being admitted are incidental COVID-19 cases. The difference is more significant in our wards, where 226 are primary COVID-19 patients versus the 1,284 with incidental COVID-19 only. While ICUs are still occupied by those with severe COVID-19, We also find that majority of them are partially or unvaccinated. Next slide. Lastly, this graph shows the number of admitted or quarantined healthcare workers. Even data for healthcare workers show they are mostly mild and asymptomatic. But even with these findings, it does not mean that hospitals and healthcare system are not burdened anymore. Our focus is to develop solutions so that our healthcare system will be able to cope with these increasing demands internally within their staff and for their patients. In parallel, we continue to remind the public to observe minimum public health standards to avoid the transmission of the virus, to immediately isolate and get tested once there are symptoms, and to use telemedicine consultations to lessen the burden to our healthcare facilities. Given all these considerations, next slide please, the DOH with our experts for COVID-19 response has proposed specific actions for the current context with the Omicron variant. The response still follows the PDITR framework wherein we focus on prevention and the mask, ugas, iwas airflow strategy, making treatment available, and accelerating the vaccination program, especially to the vulnerable. What we will discuss today are the policy updates, especially in terms of quarantine, isolation, and testing. Next slide. The updated recommendations was deemed necessary because, first, the differences in guidelines for quarantine and isolation of travelers, the general public, and specific sectors like healthcare workers had been causing confusion on the ground. From evidence, we also see the continuous rise in the number of cases, that most of the cases remains to be asymptomatic and mild cases, showing the effectiveness of our vaccines against severe disease and death. Also, most recent evidence on Omicron variant also shows that it tends to present with milder symptoms compared to the Delta variant. The prolonged quarantine and isolation duration has been causing strain to our healthcare system and our economy, and our experts believe that specifically for the Omicron variant, the benefits of shortening quarantine outweighs the risk. This seems to be consistent with global practice as we see other countries updating its quarantine and isolation processes. Next slide, please. While the US CDC is the most aggressive example by bringing down their isolation and quarantine periods to 5 days, we also see other countries moving down from 14 to 7 to 10 days. The updated policy of the Philippines attempts to find acceptable standards given our current context and allow more flexibility to groups and sectors that can strictly implement infection prevention and control procedures. Next slide. Here we will summarize the available evidences contributing to this decision. For the vaccines, all vaccines still continue to give protection against severe disease and death. Evidence review of our living CPG also shows that the average duration of infectivity and secondary attack are relatively lower for vaccinated than those unvaccinated individuals. Meanwhile, for the Omicron variant, it shows increased transmissibility with higher replication rate and higher household secondary attack rate of 19% compared to 8% with that of the Delta variant. It has also shown a higher risk of reinfection in individuals previously infected with a different strain. But evolving evidence on Omicron appears to show less severe disease, decrease in hospitalization, in-hospital deaths and ICU admissions, as well as shortened length of stay in comparison to other variants. Next slide. The evidence review from our Philippine COVID-19 living recommendations suggested that there were still inconsistent evidence as to whether there is a significant difference in the duration of infectivity of COVID-19 and the length of duration of viral transmission between the vaccinated and the unvaccinated individuals. Albeit not statistically significant, vaccinated individuals had lower chances of spreading the virus within their household and close contacts. Next slide, please. In addition to the living CPG review last year, Updated evidence are also available on the Omicron variant. In terms of vaccine protection, the study by McIntosh et al. Shows that the Omicron variant exhibits decreased susceptibility to neutralizing antibodies. It evades infection and vaccine-induced humoral immunity to a greater extent than other variants. Another investigation done by the National Institute of Infectious Diseases Control and Prevention Center shows that the viral RNA from respiratory samples was highest on 3 to 6 days after diagnosis or symptom onset, and samples were then observed to have a marked decrease after 10 days since diagnosis or symptom onset. Findings also show that vaccinated asymptomatic and mild cases are unlikely to shed infectious virus 10 days after the diagnosis or symptom onset. Our technical advisory group of experts are here to help answer your questions about the evidences in the open forum later. Given the considerations above, our updated policies are as follows. First, isolation period of individuals with symptoms and asymptomatic and mild cases had been reduced to 7 days from onset of symptoms if the person is fully vaccinated. 10 days isolation is retained for those that are partially or unvaccinated and those with moderate symptoms regardless of vaccination status. Hospital Infection Prevention and Control Committee and/or provincial health offices can shorten the isolation duration for fully vaccinated healthcare workers with boosters to 5 days upon careful assessment of benefits and risk. This shall also be expanded to other sectors with strict industry standards on infection prevention and control subject to the IATF approval. For example, we have ongoing discussions with the aviation sector. Next slide. Meanwhile, the isolation period has been retained to 21 days for those with severe and critical disease and those immunocompromised as outlined by the living CPG panel as shown in this slide. Next slide, please. For the quarantine of asymptomatic close contacts for the general public, policies are to be from 7 days, we shorten it to 5 days for those who are fully vaccinated, and we retain 14 days for partially or unvaccinated individuals. All individuals should also be reminded to continue monitoring their symptoms, wear their mask, and implement minimum public health standards for 14 days. Testing of asymptomatic close contacts shall also not be required unless symptoms will develop. For healthcare workers that are considered asymptomatic close contacts, for the sake of uniformity, they will follow the 5 days quarantine similar to the general public, provided they are fully vaccinated. We will also retain that hospital infection prevention and control committees can further shorten healthcare workers with boosters. Their quarantine can be shortened, weighing their specific situations, risk, and benefits. Next slide, please. For the updates on testing protocols, testing shall be recommended and prioritized for instances where result of testing will affect the clinical management. RT-PCR testing shall be prioritized to A1, A2, and A3 individuals. This is because those above 60 years old or with comorbidity can be provided with different medicines or antivirals within the first 5 days of their symptoms. And also for healthcare workers, surveillance or screening of healthcare workers ensures adequate healthcare system capacity to implement care in our facilities. Testing shall now be optional for community-level actions. Specifically, testing should not be required for asymptomatic close contacts. Instead, symptoms monitoring is recommended. Should testing still be used, testing should be done at least 5 days from the day of exposure. Testing should not be recommended for screening asymptomatic individuals. At this point wherein we already have community transmission, contact tracing is not recommended as a priority intervention. Next slide. We all know these updates on testing protocols will have implications to other aspects of our COVID-19 response. We are informing you now of our policy directions, but this will be subject for discussion with other agencies. Some recommendations include for the workplace, where issues on entitlements to leave benefits may arise with removing testing requirement, it is recommended that a doctor or an LGU certification shall be issued in lieu of a test result with a diagnosis of probable COVID-19. So all of those without test but having symptoms of COVID-19 will now be classified as probable COVID-19. It is important to highlight that clinical management of probable and confirmed COVID-19, especially for mild diseases, are the same. For PhilHealth reimbursement, we had been coordinating with PhilHealth to update the benefit package design, especially regarding requiring testing and minimum duration of isolation to be aligned to the new policy directions. We also need to actively disincentivize hospital admissions for asymptomatic and mild cases and promote the use of our temporary treatment and monitoring facilities or home care management. For possible implications to our case numbers, since we currently rely heavily on testing data from laboratories, similar to what is done in other countries, we plan to reduce emphasis on case numbers in our endemic scenario. We plan to gradually shift from counting and reporting total case numbers to just reporting severe and critical cases in our health system's capacity and moving to collecting data only from sentinel sites. Also, with reduced emphasis on contact tracing in areas with wide-scale community transmission, we have recommended to DILG that the roles contact tracers be expanded to implement other community health actions such as monitoring home quarantine or isolation cases, monitoring or the implementation of minimum public health standards, assisting in vaccination, assisting in health promotion, and assisting in non-COVID health-related work. In summary, because mass vaccination has significantly reduced the individual's chances of getting severe disease and dying, our policies and guidelines on testing, quarantine, and isolation are being updated to reflect the current state of information and achieve a favorable risk-benefit ratio. The presence of a highly transmissible COVID-19 variant Omicron highlights the need for adaptive changes to ensure continued availability of health and essential services. We have vaccines that prevent severe disease and new drugs to rely on for those who remain at most risk or who are unvaccinated. Even with increasing cases, the current science on benefits of vaccination and the features of the Omicron variant makes us confident to shorten isolation and quarantine period, reserve testing when assessed by physician to be necessary for medical management, and to make testing optional when actions are the same regardless of test results. Despite the promise of shorter infectivity and mild disease for vaccinated and boosted, we need to continue practicing minimum public health standards to prevent more transmission in order to avoid more variants. We hope we are able to adequately explain these policy updates, and we have the rest of our technical advisory group of experts here to answer further questions that you may have on the shift. Thank you very much, and over to you, Beth.
Thank you very much, Yusek, for the presentation. I do hope that a lot of our audience, actually there's around 1,300 of us now in this Zoom call, and another 1,000 plus more watching through our DOH Facebook page. So rest assured that the recording of this Zoom town hall will actually be available in the DOH Facebook page. Before we go into many of the questions that are on Facebook and also listed down here, perhaps we will first go through the first 5 questions that our experts have also kindly answered in the chat box, no? Para lang marinig ng lahat. So ulitin lang po natin. So the first question here, how do we know the true number of cases if some will just do self-isolation and no testing? So for this question, Doc Edsel, hope you can explain on air yung answer po.
All right. All right. I unmuted myself. Good afternoon, everyone. So, you're asking me to answer this, yung how do we know the true number of cases? Yeah, because the reason why we have been testing like we test is because of the pandemic. But the thing is, in the US, they're going on over 1 million cases na reported in one day. And this is not sustainable. And the most important action point is that there are many, many people who are already vaccinated, which means that if you're vaccinated and you're not in the vulnerable population, the worst, most likely, 99.9% of the time, you will recover. You won't require any antivirals, and you won't need to be hospitalized, which is exactly what happens with the flu. And we don't test everyone with the flu. We don't, what we do with the flu is basically we just do sentinel sampling. If there are issues about if we want to treat or somebody has to be hospitalized, that's the time we hospitalize. I mean, that's the time that we test. So very important now that we start to wean ourselves from blanket testing, or in ID we call it testing stewardship na rin. Kasi for instance, right now, we know ang PCR positivity in Metro Manila is about 50%. Now, if you tested someone who is symptomatic with antigen, which we know has an even lower sensitivity than PCR, tapos negative siya, most likely hindi mo rin naman papaniwalaan yun eh. So we're at that point where the things that we're doing need to be tailored depending on whether they impact clinical management. And if we have most people in a place already fully vaccinated, then it really won't change our clinical management. And so it might be better to just be more efficient by just doing sentinel surveillance. And more importantly, for people who are already symptomatic, isolate na lang para hindi na sila mag-spread. Thank you.
Thank you very much, Doc Edsel. So basically, this means we will actually slowly move out of making sure that we calculate every single COVID case in the country, which we actually don't do for other infectious diseases like influenza. For the second question, this is for Doc Isa. There's a question from the floor on whether we can give booster shot for patients who recently had COVID infection. Ma'am, over to you po.
Yeah. For timing, this is question on timing when to get boosted. As soon as fully recovered, no symptoms, you can get scheduled already for your booster. That's assuming you're fully vaccinated already. Okay. Yeah.
Thank you, ma'am. There's also a question here on how can we know if the Delta or Omicron variant is what the patient has. Doc Edsel, I'll go back to you for this po.
Yes, there's really no way clinically to figure out if somebody has Omicron or Delta. I mean, we can talk about it in general terms, where Omicron is relatively milder than Delta, but on an individual basis, hindi mo makikita yon. But what we're seeing right now, very fast transmission, lots of breakthrough, but generally mild disease, especially among those who are fully vaccinated. That's indicative of Omicron. But on an individual basis, there's just no way you can tell that without sequencing.
Thank you, Doc. And we also remind everyone that sequencing is very limited. We're not actually doing it for every single patient that we have. So now I'll go on to our Facebook question. Here's a question for Doc Anna. Just want to confirm, when are we going to start the quarantine period? Is it after RT-PCR results was released or from the onset of symptoms? Especially now that in some cases, RT-PCR results are delayed. Doc Anna?
Yeah. Thank you for raising that. No, it's a very common scenario. And we actually want to count our number of days of isolation from the day that symptoms started. because we recognize that there are instances where testing is significantly delayed. So kung gagamitin naman natin yung date of sample collection at 5 araw na matapos magkaroon ng simptomas ang isang tao bago natin bibilangin yung kanyang isolation, lumampas na rin dun sa period kung kailan nakakahawa siya at nakakaperwisyo din dun sa kilos ng pasyente at ng kanyang pamilya. So onset of symptoms, if it can be reliably determined, is the standard.
Thank you very much, Doc Ana. Question for Yusek. After po ba ma-isolate, required pa rin po ba magsagawa ng retesting?
Yes, Peb, no? So dati pa ho natin protocol yan na hindi na ho tayo nagre-require ng repeat test kapag po kayo ay nag-isolate because you were confirmed positive with COVID-19. Experts have recommended and science dictates, no, may mga ebidensya na pong lumalabas na pagdating po ng ika-10 araw at onwards, kapag kayo ay nagkasakit, hindi na ho tayo infectious, no? So we can declare our patients already or individuals who have completed their isolation as long as without symptoms anymore for at least 3 days, walang lagnat for 24 hours, na recovered na po. So no need for repeat testing.
Thank you very much, Yusek. Our next question is for Doc Isa. Does it mean that incidental COVID-19 that patients are asymptomatic? Or should we be alarmed by this situation?
Yeah. Asymptomatic, no? So the implication there is we still have to continue practicing our preventive measures, no? So kasi pwede kasing 2 days before symptoms, actually pwede nang nakakahawa, no? So kaya ang ating ano pa rin, advice is really to wear mask when going out, no? And if you cannot do physical distancing, so mask and physical distancing pa rin tayo because of the asymptomatic stage, no, of COVID. Okay, so merong 2 days kasi before symptom na pwede ka na rin makahawa.
So Doc Isa, just to clarify, medyo afraid ata yung health workers na if incidental COVID, automatically ba na asymptomatic yun or hindi natin ma-ascertain yun, no? So incidental COVID can also be, they can be symptomatic as well.
Oh yes, oo. Pwede kasi, 'di ba, non-specific kasi rin yung symptoms ng COVID, no? Fever, lalo na yung fever. So if you came in for another condition na nagpe-present din with fever, tapos lalo na tong Omicron, very mild kasi yung kanyang symptoms, no? So pwedeng hindi na pick up sa history na meron ng konting nararamdaman, but we did not consider it as really bothersome, kaya hindi siya declare as a symptom, no?
Thank you, Ma'am Isa. Doc Ana, this is for you. Do you still mandate RT-PCR testing for all who display minor COVID symptoms?
So as was shared earlier in the discussion, kung meron tayong influenza-like illness symptoms, no, or even symptoms that can overlap with that of COVID, right now, if they are mild and it's supported by exposure history, ang pinaka-essential na action is actually isolation. That's the first thing to do. And then try to access testing. Now, granted na mahirap nga talagang makahanap or makapag-book ng testing schedule for so long as this individual is not in the A1, A2, or A3 category. I think that the need to test, no, can be deprioritized, and we focus on isolating and providing relief for symptoms of this patient. All the while, no, thinking about a possible alternative diagnosis until pwede nating establish. So I know I'm talking to an audience of healthcare workers, kaya naintindihan nyo itong strategy na ito eh. Medyo mahirap lang i-translate sa general public, pero gano'n naman ang ginagawa natin, di ba? Pagka kunwari, meron tayong mga pasyente na hindi natin mapatest kaagad. Iniisip natin, ano na ba pwede natin gawin? Anong worst case scenario? Ina-anticipate natin yon habang ginagawa natin ang paraan para matest. In many instances, dahil mild, nakakalampas nga tayo ng hindi na natin tinest, gumaling na yung pasyente doon sa ginawa natin. So maaring in many instances, ganito yung gagawin natin ngayon dahil nga mahirap makapagpatest. And pangalawa, malamang sa hindi, COVID yan.
Thank you, Ma'am Ana. So prefer to isolate immediately, and whether testing will still be necessary, that is for clinical judgment. Pero yung priority natin, makapag-isolate agad. This question is for Doc Isa. There's a question whether we should define fully vaccinated as 3 doses and not 2 doses.
Okay. For the terminology still, we adopt fully vaccinated is 2 doses, for 2-dose regimen, like Pfizer, mRNA, and then fully vaccinated na 1 dose pag 1 dose lang yung regimen like Janssen. So we are not changing. The 3rd dose is called a booster. Okay, so fully vax plus booster. So hindi siya hindi na first the yung additional or 3rd dose is the booster. Then ano rin kasi, di ba, booster is kasi bumababa yung antibody levels, yung vaccine effectiveness, kaya tayo nagbo-boost. And then meron pang tinatawag na additional dose naman for the immunocompromised, kasi they are expected to have lower, the effectiveness of the vaccine is lower dahil immunocompromised sila, hindi sila makamount ng immune response. So we give an additional dose. Okay.
Thank you, Doc Isa. Doc Edsel, this next question is for you from Carmina Cortez. If the patient is still shedding until 6th day, why are we shortening the quarantine?
Yeah, I think that's a misnomer kasi when you're talking about quarantine, hindi pa confirmed na positive yung patient. Maybe what that person means is viral shedding in somebody under isolation. And that is why 6th day, kung fully vaccinated, our shortening is to 7 days for isolation kung fully vaccinated. Pero kung hindi siya as another layer, because we know that vaccination also affects infectivity. But for unvaccinated, we're keeping it at 10 days for now. So mas safe tayo than what CDC is proposing. Now, yung sa quarantine na shortened the 5 days, this is also premised on the fact na a lot of people who have Omicron will start to manifest symptoms in 3 days. Unlike yung dati na 5 days, yung Delta and the other. So that's the premise there. That's why we're shortening quarantine, not isolation for already confirmed people. So yung sa quarantine, we're observing people who have exposure for 5 days if they are fully vaccinated, because the vaccination still has an effect also even on infection. It's not zero, so you still prevent infection in some people. But at the same time, instead of going to 7 days, which we used for the other variants, we can do that as we see more and more Omicron circulating. Pero kung unvaccinated ka, nasa 14 days pa rin yung quarantine na yan.
Thank you very much, Doc Edsel. Yusek, this question is for you. Are all LGUs required to follow this new PDITR guidelines? Some provinces like Batanes have different epidemic curves and had different surge of cases, and surge of cases are delayed compared to those in mainland Luzon.
Yes, no? So unang-una po, we just like to highlight that local governments should always have stronger measures to implement our protocols. They go beyond nga dun sa mga protocols na pinapatupad natin. Ito pong protocols na binibigay natin ngayon, hindi po natin sinasabi na magiging applicable. Like when we say contact tracing, for example, we're saying contact tracing will take a backseat, no? O hindi ho siya priority intervention in areas with high infection rates. Katulad po dito sa NCR, mas mabilis na po ngayon ang infeksyon na kumakalat kesa makapag-contact tracing tayo. And based on epidemiological concepts, hindi na po applicable na magko-contact trace pa tayo pag ganito na po ang transmission and infection rates. As compared to Batanes, for example, wherein we have low cases, contact tracing is still very valuable. Ngayon, yung iba po nating mga pinapatupad katulad ng shortened quarantine and isolation, this will not be area specific. This is specific to differentiate vaccinated from the unvaccinated because science says na kapag bakunado ka, yung viral load mo mas kakaunti, mas shorter po yung duration na kayo ay infectious. Kaya po natin yan ginagawa. So we are now implementing this across all regions, across all areas, but not for the other interventions like contact tracing. Bev?
Thank you very much, Yusek, for clarifying that. Siguro, Yusek, baka pwede na rin natin i-clarify at this point yung option, no, ng mga hospital infection prevention and control committees and the PHOs dun sa
Yes, no? So gusto ho nating klaruhin yan. Kasi in general principles po dito sa policy natin, 5 araw po ang pag-quarantine natin para po dun sa mga asymptomatic close contacts. Ibig sabihin, walang symptoms but we're exposed to a confirmed positive individual. Pero binibigay pa rin po natin ang authority sa ating infection prevention and control units ng ating mga ospital, ng ating mga provincial health offices, city health offices, and municipal health offices that they can decide and determine kung gusto pa nila, kung maaari pang i-shorten ang duration ng quarantine period. Dahil nga po, alam natin kapag healthcare workers yan, mas disiplinado po yan na nag-PPE. Yung kanilang pagsuot ng PPE ay talagang appropriate po ang fit at alam po natin na protektado sila at protektado ang ating mga pasyente. This is not to put our healthcare workers or our patients at risk. This is still based on science. This is a contingency planned by government so that we can preserve our healthcare system. So yung authority po nasa ating infection prevention and control units. Hindi po natin sinasabi na lahat ay magpapatupad. It will depend on your infection prevention and control units weighing the risk over the benefits. Bev?
Thank you very much, Yusek. Doc Anna, this question is for you naman po. What do we do if a patient refuses to be tested but has symptoms likely COVID? After advising them to isolate, we can never be sure if they are truly doing what we advise them.
Kakalungkot, no? But it's actually a scenario, again, that we commonly encounter. Siguro, isang pwede nating gawin as healthcare workers is really to just emphasize to them and make them understand the risk that they pose to their own households and their workplace colleagues, no? If they don't follow the isolation requirements that we recommend, no? And you know, there are many interventions that we as healthcare professionals will inform our patients about, but in the end, sila pa rin naman talaga ang nasa sa kanila pa rin yung pagsunod. So the only thing siguro na kaya natin gawin na kaya natin, no, to be responsible for is to make sure that the information is communicated and well understood.
Thank you very much, Doc Anna. Doc Edsel, here's another question for you. How sure are we that the patient is infected with Omicron and not Delta to make us confident to shorten isolation or quarantine period? What if the patient is actually infected with Delta?
Yeah, actually, ano naman, again, if you're fully vaccinated, we already made this stipulation that it's an extra layer in terms of decreasing the amount of virus that you're shedding. So, and also the fact that ang nagsisirculate talaga ngayon, mukhang, if you look at the patterns in the US, Omicron took over very, very fast. So based on those patterns, plus the fact that we already have these extra layers, I think that the current measures are reasonable because it'll capture, if most of this is Omicron, then we're good. Kung may ilan-ilan Delta dyan, we're only doing the shortened quarantine and isolation for vaccinated. So we have an extra layer.
Thanks, Doc Edsel. Ma'am Isa, this is for you naman po. So there's a question here whether in hospital-based testing of healthcare workers who are symptomatic or close contact, can the hospital actually use qualified antigen test or perhaps FDA-registered antigen test as the initial test in order to facilitate faster tracing within the facility? Dr. Isa, please unmute. Yeah, thank you.
Ayan. Okay, sorry, nakamute pala ako. Yes, if there are issues on access with RT-PCR or the RT-PCR lab is unable to accommodate anymore the high burden of request for tests, yes, validated rapid antigen tests can be used to facilitate isolation. But as we've said already also that if with symptoms, isolate na kaagad, even without the test. Then if you have access to tests, then yes, you can do rapid antigen or RT-PCR. Depende. Yung current surveillance, kasi ngayon, kaya lang yung sa surveillance natin, ang nare-record pa lang is RT-PCR confirmed cases. So yung rapid antigen, hindi siya nare-record. But I believe DOH will also put some measures not to be able to account for the rapid antigen testing. So parang we just need to be clear ano yung purpose na natin kasi for counting. So ngayon that we have the surge, pinaka-importante is to cut transmission. Kaya once with symptoms, isolate. Then tsaka na lang mag-test if needed. And then we also are promoting targeted testing na.
Thank you, ma'am. Siguro later on, we can have USEC Rosette share to us ano yung mga kinokollect na po ng DOH na data on antigen test, para medyo aware din po kayo. But before that, I'll just ask this question to Doc Edsel, coming from Doc Mario Festin. The presentation shows that after 10 days, Omicron viral shedding is unlikely. How do we measure viral shedding using tests? And would there be clinical manifestations that one is not shedding the virus?
So there's really no clinical manifestation that will tell you whether you're shedding virus or not because we have asymptomatic shedding. Viral shedding is measured by viral culture actually, and they do it in a serial fashion. The closest to viral culture in terms of infectivity is actually an antigen test, except that antigen tests are not approved to measure infectiousness. And in fact, there was a recent study where they used one test or two antigen tests, and they found that you needed two antigen tests to be significantly sure that you were no longer shedding if they were going to go for an abbreviated release. So it's not really all that helpful if you're going to use antigen. And again, these antigen tests have not been studied in this kind of clinical setting. Intuitively, it makes sense kasi ang antigen test, ang sensitivity niya is about the CT value of 30. But again, iba-ibang tests yan, lalo na the self-administered ones. Some of them are fly-by-night. Very difficult to make firm conclusions on using antigen to say someone is infected or not. So we're not doing that. Time-based is still the way to go. We can use it to supplement, but the guidelines for that are still being made.
Thank you, Doc Edsel. So siguro at this point, Yusek, maybe you want to share about our current collection po for antigen test.
Yes, Bev, no? So ang antigen test po na mga resulta, we had been collecting this for the longest time since I think latter half of last year. Nag-umpisa po tayong humingi sa ating mga local governments through our regional offices that they submit to us the use of the rapid antigen test. Unfortunately, submissions were not complied with. meron ho tayong kakulangan, yung iba naman po magsasubmit but we're not validated. We need to validate the antigen test na ginagamit po kasi dahil yung iba po ginagamit for screening, yung iba ginagamit po sa ibang paraan na hindi naman po appropriate ang use, hindi appropriate ang timing, and therefore we cannot rely that these are accurate results. So ngayon po, nagde-develop tayo. Ang nakapasok po ngayon sa ating reported cases are all RT-PCR tests. Pero po, ngayon nagde-develop tayo ng isang system kung saan meron po tayo yung tinatawag na Kira chat box. We are now developing this system wherein people can just input if they've had antigen test and what their results are. This will be anonymized so that we can somehow get the sense, no, kung ilan po yung antigen test positive sa ating komunidad. So in the coming days, we will be issuing this out so our community also, our individuals at homes who are using antigen tests can also help government so that we can have these numbers for the antigen tests. Bev?
Thank you, Yusek. So yun din po, no, we expect our health workers who are authorized under our guidelines to do the antigen test to actually submit to their local epidemiological surveillance unit. So may mga reporting forms po yan. So whatever we're getting is really based on how many have reported. Okay, so Doc Ana, this question naman po is for you. There's a question by Ma'am Evelyn Natividad in Zoom. If symptomatic, when is the best time to test with antigen test? Like first day of symptoms ba or can be within 3 to 5 days?
Let's remember that once a person is symptomatic, the likelihood is that there is sufficient viral load to be picked up by a test that has sufficient sensitivity. So typically, kung symptomatic na, kayang-kaya na ng RT-PCR yan na ma-pick up, magpa-positive na siya. Ang problema is the antigen test has different levels of sensitivity depende dun sa pagka-craft ng test. So pwede nang mag-test dun sa antigen kung may symptoms, pero alam naman natin na pag nag-negative yun, magre-recommenda pa rin tayo na magpa-RT-PCR dahil naintindihan natin na yung antigen, the sensitivities are lower. So yun yung parang what we need to watch out for. In a symptomatic individual, you can do an antigen test, but if it's negative, you have to follow it up with an RT-PCR. Pero sabi na nga natin, di ba, we de-emphasize testing, we emphasize isolation. So isolate, try to find a way to get a test if it's possible. If not, correlate with the symptoms and the exposure history, manage while you're trying to access the test.
Thank you very much, Doc Ana, for that. This one naman is for Doc Isa. Is RT-PCR, a repeat RT-PCR needed for a confirmed COVID-positive health worker before going back to work? If yes, when po? Unmute.
Isa, you're muted.
Okay. Yung current guidelines kasi natin for healthcare workers, we have the test-based strategy, no? At least one RT-PCR, at least one negative RT-PCR before returning to work. Yun. Or, but then we also correlate it again with the CT value, no? Kung if it's high already, then we can clear the healthcare worker to return to work as long as asymptomatic already. Yun yung the symptoms have resolved, no fever for at least 24 hours and improving respiratory symptoms. So those are the guidelines for our healthcare workers.
Thank you,
They
ma'am.
answer it. Yeah.
Yes po. Doc Edsel, this is for you po. I'll combine two questions from Facebook natin. So if a COVID positive patient has completed 10 days of isolation, pero after that may mild cough pa din siya, can he receive his booster shot? And can they report to work?
Yeah, I mean, our guidelines will say na we have this isolation period. And first of all, dapat 24 hours na wala ng fever without use of antipyretics and at least improving na lang yung mild symptoms. So as long as tapos na yung isolation period and they're at least 3 months out from their second vaccine dose, then they can go ahead and receive the booster.
Okay. So yung mas mahalaga, no, yung 24 hours without fever, but not using any antipyretic. So yung mild cough na remnant, pwedeng okay pa. Alright. So our next question is, ito siguro for USEC, what is the target date for vaccination of children 5 to 11 years old this year?
Yes, no. So we already received the emergency use authority for one of the brands of vaccines that we have right now for our 5 to 11 years old. Ito pong December of 2021. Inaantay na lang po natin ang delivery ng supply sa atin, and we had a meeting with the manufacturers already. They committed to provide us their deliveries by the end of January or first week of February. So as soon as deliveries are here, the supplies are here, we will start na po with the 5 to 11 years old vaccination.
Thank you, Yusek. So yun na lang po, hinihintay natin dumating yung bagong stocks ng Pfizer for 5 to 11 years old. Doc Ana, this is for you. Considering marami pong medyo nagkakahawaan within families, no? There's a question here. If you are taking care of a COVID positive relative, when do we start counting the day when we need to do the test, given you remain asymptomatic even at day 5 of illness of the positive case?
Technically, dapat from the last day of exposure eh. Kaso nga ang problema, di ba, continually providing care ka, kaya constantly exposed ka. That will be a little tricky. I would say na at the minimum, 5th day from the first date of exposure, then you'll have to really observe closely if you still turn negative. Kasi intindihin natin yung principle, di ba? What you're trying to catch by testing on day 5 is the point at which you have sufficient viral load para makita ng RT-PCR. So kung continuous yung exposure mo, yung day 5, umuurong ng umuurong yun. Kaya baka hindi lang minsan ang testing mo.
Thank you very much, Doc Ana. Medyo complicated na. This is for Doc Isa. Na medyo how many times can a person acquire COVID infection?
I wish I knew the answer. No? As we've seen, no, reinfection, breakthrough infections have happened. No, even with vaccination, we've seen that because it depends on the how the virus is evolving, and also how vigilant are you, no, or how kung gaano ka kagaling magprotekta ng sarili mo. No? Depends on your exposure, your environment, okay, and yun nga, your immunity also, no, yung host factors, no, how your immune system, if you have comorbids and all, then you're at a higher risk of reinfection if you don't again practice preventive measures or you get exposed. Okay, so there are several factors to consider, no, and we've seen already that we've had breakthrough infections, no, even among boosted or vaccinated individuals with Omicron, kasi nga because of the mutations, no, the vaccine effectiveness, no, in terms of neutralizing the production of neutralizing antibodies, the effectiveness of the neutralizing antibodies is decreased, no, with Omicron as a result of the mutations of the virus. Yes.
Thank you very much, ma'am. Doc Ana, this next question is for you. What if the booster shot coincides with COVID-19 infection? Do we still need to be boosted again, or natural immunity is enough?
Well, I would hope na sana kung infected yung tao, hindi niya sinadyang pumunta dun sa vaccination center kasi sabi natin ayaw naman natin makapanghawa ng iba, no? Kahit schedule na ng booster shot na pinakihihintay natin. So malamang accidental yon, di niya alam na positive siya kaya pumunta pa rin siya dun sa vaccination center. Currently, ang recommendation natin, nagre-recommend pa rin tayo ng booster kasi hindi nga natin alam yung duration of protection na ibinibigay ng natural infection. Ang meron lang naman talagang studies ay nakikita natin sa mga vaccine trials. So kung gusto natin ng medyo mas defined na durations, at rather dahil gusto natin ng medyo mas defined na durations, we still encourage that such individuals should be boosted with vaccination.
Thanks, Doc Anna. Doc Edsel, this is for you. What is the indication of baricitinib 4 milligram tab? Can we give it to a 78-year-old afebrile, COVID-confirmed moderate? What are the possible side effects?
Yeah, don't give it. You only give it to severe na may risk of progression. That's for baricitinib and tocilizumab as well. You don't want to give that to somebody who does not fit those parameters because bari and toci are both immunosuppressive, so it can cause harm. So dapat ano talaga, and those have to be given in the hospital. So the answer is no, don't do it.
Thanks, Doc Edsel. Ma'am Isa, sa'yo po ulit to. If COVID is considered airborne, what is the value of face shield?
Okay. Face shield is just an added layer of protection. No? It's really it prevents you from touching your face or your eyes. The evidence no for face shields is actually more, yung studies is on eye protection, especially for healthcare workers taking care of patients, no. Even kasi non-COVID, lalo na sa surgery, we advise eye protection to avoid splashes. So it's really for contact, no, prevention of close contact. Yung face shields, it's an added layer. It's not really for the airborne part of or transmission, no. Kaya, so yun ang use ng shield or eye protection.
Thank
For
you, ma'am.
droplet contact precautions. Okay.
So as we always emphasize, it's layers of protection and no single intervention can actually protect us fully from COVID. So, but thank you for that question kasi maraming nagtatanong doon. Our next question, Doc Anna, a pregnant who finished her primary series already, can she get her booster shot? How soon? What if she's breastfeeding?
So pregnant women are allowed to receive primary series and booster shots according to the regular schedule as with other adults. And breastfeeding is not contraindicated for for lactating women who have been boosted. And in fact, di ba nga, may nakikita tayong mga studies ngayon na nagsasabi that antibodies are detected in breast milk. So we're hopeful that sana this antibody that can be passed on to the child will provide some degree of protection to the young infant.
Thank you, Doc Anna. So may follow-up question tayo dito from the timing of booster shot question kanina. No? So there's a question here, do we wait for the minimum 3 months to get the booster for a fully vaccinated patient who just had COVID infection? So do you wait for recovery or do you wait for 3 months after their primary series? Maybe Doc Isa, you want to take this one?
Isa, your new
Important that you are recovered, no? You have no symptoms. And then 3 months from, the earliest is 3 months from the second dose of the primary series. Okay, or the first dose, kung 1 dose lang yun. At least, earliest is 3 months, yes.
Doc Anna, this is for you, healthcare worker question. So what if a health worker has a known case of allergic coughing or asthma and becomes RT-PCR positive but has no symptoms other than coughing occasionally? Should isolation be continued as long as with cough, or still 7 to 10 days isolation is enough?
Nako, feel na feel ko yung question na yan kasi parang ganun kami sa bahay. Nagsasagutan ng sneezing tuwing umaga. So araw-araw na lang nagtitinginan kami lahat, di ba? Medyo mahirap, no? Kasi lalo na kung may baseline symptoms ka. So siguro yung ganitong kaso, medyo dapat maganda yung awareness mo about what's typical for you and what's out of the ordinary. Kailangan bang ipagpatuloy yung isolation hanggang mawala yung symptoms? Siguro isang practical way of doing it is i-optimize mo yung anti-allergy regimen mo. At kung hindi pa rin talaga nagre-resolve, baka naman warrant or parang prudent na magpa-test ulit bago ka bumalik sa work kasi mahirap mo talagang maibase sa symptoms na lang.
Thank you, Doc Anna. Doc Edsel, another drug question. Is molnupiravir given to COVID-positive patients with mild symptoms who are unvaccinated, vaccinated, or both?
Yeah, so the indication for molnupiravir is for patients who are high risk with mild symptoms, meaning either A2 sila or A3, and they have mild or moderate symptoms. So baka mag-progress kasi to severe. It has to be given within 5 days of the start of symptoms. Yung studies were in unvaccinated. So the data is not as clear for fully vaccinated, but you can give it to vaccinated depending on risk assessment by your infectious disease physician or your pulmonary doctor. But for non-A2, non-A3, you really shouldn't be giving molnupiravir at all.
Thank you for clarifying that, Doc Edsel. Our next question is actually, people are asking now whether we're going to post the guidelines. So yes, there will be written guidelines issued out tomorrow on this, as well as a set of materials. So DOH is updating all our materials, and later on I'll show you the link where you can access most of them apart from our Viber group and our Facebook page. All right. So may question naman po dito also on retesting in company setting. So, Doc Anna, I'll give this to you. So, on retesting on private companies, some airline companies are requiring retesting. Is this an individualized approach depending on the agency or on country ba or on a medical protocol?
Requiring retesting up before clearing to go to work. Is that
Yes,
it? No?
Yes
Oo.
po.
Well, nabanggit nga natin kanina, di ba? Hindi naman talaga natin nire-require ang retesting kasi ang ating release from isolation post-recovery is based on time rather than test. The reasoning behind this is the knowledge that RT-PCRs can remain persistently positive for a fairly long time, up to 90 days, even without being able to culture viable virus. So these repeat testing prior to clearance for work are usually imposed by certain industries. Like for example, sa atin sa healthcare, no? Minsan hinihingi yun. And sometimes in the airline industry because they're quite sensitive to penalties and such things that happen whenever they're identified as having positive staff. So based on the science, the caveat really is persistently positive tests can be seen after the period of infectiousness has passed.
Thank you, Doc Anna. Doc Edsel, this is a question for you. For cancer patients with ongoing treatment in our facility, is it wise to regularly test everyone, including health workers, even at least using rapid antigen tests? Just the past 5 days, we had 9 asymptomatic COVID confirmed patients, both health workers and patients.
Yeah, I mean, we don't want to do antigen tests for asymptomatic kasi hindi talaga siya sensitive. You're gonna miss 3 out of 4 people who are positive if you're just using antigen. So there are hospital protocols for admission where they do PCR. There's a 72-hour window, and also the healthcare workers some of them are screened periodically. But even on top of that, required pa rin talaga yung proper PPE when going into patient rooms. So all these safeguards are in place, and each hospital has its own protocol, and these get adjusted depending on how much transmission is going around in the community. So if you have specific questions about this, these are questions for the hospital infection control in your area.
Thank you po. Doc Anna, this is about households infected again. So in a household where all are infected with Omicron or COVID, and some have recovered faster than the others, is there a possibility that they will be reinfected if they still mingle with those exhibiting with symptoms? And so what should we advise our patients in this case?
Yeah. Again, another very common scenario now kasi households na yung tinatamaan. So basically, ang tinitingnan natin dito, dahil magkakasama sila lahat, no? Hindi madalang naman ang household na talagang nakapaghiwalay yung mga tao. Pagkatapos na dapat yung isolation ng isang member, i-release mo na siya from isolation. Kung nakumpleto na niya yung required number of days, di ba sabi natin, 7 days pag vaccinated, 10 days pag unvaccinated, and mild sila lahat. So ma-reinfect ba sila? The likelihood is hindi, no? Kasi syempre yun na yung umiikot na virus dun sa sa pamilya ninyo. So from a practical standpoint, what I advise my patients is once they're done with their isolation period, they may discontinue and resume their regular activities and help the other members of the family who are recovering.
Thank you, Doc Anna. Doc Isa, this is a question from a health worker, Francis Villar, who's in our Zoom call. For a health worker who's COVID-19 positive, who already underwent home isolation for 5 days, a febrile for 24 to 48 hours with minimal cough, would he be required to undertake repeat RT-PCR testing?
Okay. Minimal cough. So mild case siya, di ba? Tama? Kasi sa atin, kung mild, the isolation is 10 days. Di ba? So we need to isolate for 10 days and then repeat RT-PCR and then check the CT value. No? If it's still low, then extend the isolation. No? If kung mild. But if it's already high, the CT value is high, then the patient the healthcare worker can go back to work. And again, the advice always is still to practice yung proper PPE. No? As a healthcare worker naman, we have to keep ourselves protected. No? Not just ourselves, but also the patients that we handle. So the protection is both ways.
Thank you, ma'am. Doc Edsel, there's another question here. If we give booster COVID shots as soon as well from the disease, what happens to the natural antibody production? Will there be no overlapping?
Like a booster shot and infected? Tama ba?
Yes po.
Yeah, there really shouldn't be a huge issue with that kasi predictable naman yung natin yung amounts of antigen that we put in our vaccines. Hindi predictable yun sa natural infection, and that's why we boost. That's why we still vaccinate people who are who already got wild type disease, and we boost them as well. Of course, the immune system is really complicated. There's there are overlaps and everything, but in general, when these kinds of things happen, the more appropriate guidelines are still what we say. People who had past infection, give it at the right schedule as long as tapos na yung isolation, hindi na symptomatic, and just follow the schedules. If there's a delay, it's okay because the delay can be catch up. It doesn't go back to square one naman.
Thank you po. There's a question from Chris Lex Guerzo, and I am opening this up to all our experts who might want to answer. Is the assertion that vaccinated people shed fewer virus particles and for shorter period of time still based on the small Singapore study, or have there been newer studies on the fact that vaccinated people shed fewer virus particles? Anyone from our experts?
Yeah, there's multiple studies actually already. There's a Nature study that showed na the logs of virus for vaccinated are lower. The amounts of virus that are shed in general are lower for fully vaccinated than for unvaccinated. There's UK studies. There's multiple studies. Even Chinese studies have also shown that it's not just one study.
Thanks, Doc. More healthcare worker specific questions. So medyo maraming scenario lang, pero it will be useful to go through them, no, for the benefit of our listeners. This is for Doc Ana. For healthcare workers who have been tested positive and also symptomatic, if they remain rat positive after 5 days and still symptomatic, will the 5-day shortened quarantine, actually, isolation. So, apply, or shouldn't we recommend longer duration?
Okay, so I'm trying to imagine the scenario. Una, hindi naman natin inuulit yung antigen test to determine status ng isang pasyente, whether healthcare worker yan o hindi, di ba? Sabi nga natin, ginagamit natin ang time rather than a test-based strategy to release from isolation. So in this case, tanggalin na natin yung status ng antigen test. Ang problema natin ngayon is yung ating healthcare worker on day 5, sasabihin na sa kanya, pwede ka na sanang bumalik sa trabaho. Tama ba? Yun ang natirang scenario doon, di ba? So, unang-una, sabi natin, ang isolation period natin is hindi 5 days kung hindi 7. Tama? Tapos, pagkatapos ng day 7 na yon, syempre, meron ka pa rin assessment ng iyong IPCU, lalo na kung may symptoms ka pa. Kasi, syempre, ayaw din naman nating makompromise yung health mo o yung health ng pasyente. So, kung symptomatic ka pa, hihingi ka talaga ng evaluation galing sa iyong health service sa institution bago ka pabalikin sa work. Hindi that will not typically fall within those mga automatic work release scenarios kasi nga symptomatic ka.
Thank you, Ma'am Ana. Doc Isa, ito very practical question from Facebook, considering again households are all most of them are infected. Can we mix 2 people with the same symptoms in one isolation room?
Yes, if parehong COVID naman, di ba? We can cohort or pagsamahin sila sa isang room. Especially kung limited yung rooms ng bahay. As long, pareho silang may symptom, pwede naman.
Okay, thank you very much, ma'am. There's a question from Doc Dante Morales. When can we have booster vaccination for 12 to 17 years old? Siguro, evidence review muna natin.
I think it's starting na in the US, di ba? In-approve na ng CDC for Pfizer, but I don't know dito. Well, kailangan pa natin yung 5 to. Kailangan pa natin yung 5 to.
Question yan, Dev. Baka ops question ang tanong ni Dr. Morales. Kailan ba magkakaroon? Yan ba yung tanong?
Okay, sige sir. Balikan namin kayo dyan. So, may question din dito in general, no, about the quarantine guidelines and isolation guidelines on how different it will be for travelers. USEC, will we want to just clarify in general how different or similar will the healthcare worker guidelines, general population guidelines with the travelers po?
Yes, with these updated protocols that we are presenting right now, we've tried to align our quarantine and isolation protocols among the different sectors in society. So we have protocols before specific for healthcare workers. We had protocols for the general population, and we had protocols for travelers. So what we did together with our experts, we aligned all of this. So for our travelers, we will still follow the country risk classifications, the red, the yellow, and the green. But we have reverted back, no? We have proposed to revert back to the previous, and then we still differentiate from vaccinated and unvaccinated. So if you would find the quarantine and isolation protocols would almost be the same for travelers, for healthcare workers, and for our general population, differentiating between the vaccinated and unvaccinated.
Thank you very much, Yusek. So, siguro for our audience din po, know that the guidelines for healthcare workers and for the general population, it's well within our DOH kumbaga, ability, no, policy making powers. But for travelers, no, we still need to work with different agencies kasi marami pong in charge doon. No? So this is already our proposal, and so lalabas din po yung policy doon. Basta mag-align po siya, but there might be just a day or two na delay in terms of releasing that policy. But rest assured that all, as sinabi nga ni Yusek, will be aligned po. So, may question po tayo dito from Ma'am Regina Pasolis. This is for Ma'am Isa. For immunocompromised elderly patients, how soon after the booster should they receive a second booster?
How soon after
the booster should they get another booster?
immunocompromised, no? So they get the primary series, and then they get an additional dose that is for their, so that they will have the complete series. So that's where we are now, for now, no, for the immunocompromised, 3 doses. Okay, and then the earliest would be still 3 months, no, from the last dose. That's what we have the evidence for now, no, for in terms of timing for boosting. Okay.
Thank you, ma'am. So yung clarification dun is as of today, all our guidelines just allow every person to get until the 3rd dose. No? Whether it's your 3rd dose or your booster dose, basta yung total mo, 3 tusok ng COVID-19 vaccine pa lang. So I think medyo na-answer na rin to because some people are also asking, when will we be needing a 4th dose? No? So our LCPG team or Living CPG's team continuously reviewing evidence globally on when we should do this already. So probably we are down to our last 3 questions. We've answered a lot of questions already, but are down to our last 3, and then we will ask our experts and USEC to say their final advice to our healthcare workers here. So here is a question po for Doc Anna. If a person goes out of the house for a whole day or overnight in one place, how many days do you recommend for the person to quarantine before returning back to the family to avoid transmission? That is if the person has no known exposure to a positive case. Ito yung para sa mga maingat na maingat.
Actually, iniisip ko wala naman yung pinagkaiba dun sa ginagawa natin sa araw-araw, di ba? We leave our homes, we go to work, we come back to our homes. And because we leave our home bubble, there are exposures that we can only try to mitigate. We cannot be 100% sure that we have been fully protected. So I think staying out overnight is pretty much the same scenario. But if you really want to be 100% sure, then you assume that you were exposed when you went out, then your quarantine should follow your vaccination status, 'di ba? Kung ano yung kung ikaw ay unvaxxed, aabutin ka talaga ng 2 weeks, at kung ikaw ay vaxxed, then pwedeng mag-shorten. So siguro yun na lang ang guideline na pwede mong sundin. Pero dahil nga hindi yan realistic, 'di ba? Kasi we need to interact with our families. then the solution there is really to try to control your exposures by making sure that you follow your minimum public health standards and put on as many layers of protection as you can.
Thank you. Thank you, Doc Ana. Doc Isa, this is for you po. Is there a need to do the usual chest X-ray and inflammatory markers if symptoms are mild and patient has no DOB? If not necessary with this variant, what specific profile do you recommend doing this test as part of the workup?
Yeah, for healthy, no comorbids, you don't need to do the inflammatory markers. So we usually monitor these markers among the elderly, those who are at risk for progression. So elderly and with comorbids, then and if they have respiratory symptoms, then we monitor the inflammatory markers and we can do a chest X-ray for them.
Thank you, ma'am. Siguro may konti lang mga pahabol na questions pero baka important din. Doc Ana, do you recommend swabbing babies?
Depende sa circumstances. So siguro if I can share our experience in the Philippine General Hospital, no? Pagka kasi may clinical presentation na compatible or confusing for COVID and other conditions with overlapping symptoms, of course, we will swab. Kailangan eh. Pero kung kunwari ang scenario mo ang bata or ang sanggol may lagnat, coming from a household na lahat may COVID, parang I think it's no longer necessary to do a test in this particular infant unless meron siyang severe symptoms at kailangan mo siyang ma-hospitalize. So very situational. But kung kailangan gawin, you can go ahead and do it. Hindi naman siya sobrang hirap at sobrang traumatic sa infant. Mas na iilang pa yung parents kaysa dun sa bata kasi kung tama natin siyang ginawa, mabilis lang naman. Kung kailangan, gagawin pa rin.
Thank you, Doc Ana. Doc Edsel, for molnupiravir, do you have advice on contraindications? Kasi mabilis tong ma-secure ngayon, no? Maraming nagbebenta.
Yeah, I mean, molnupiravir is an antiviral, and actually, originally, ang naging issue with molnupiravir is that it had some a potential to affect genetic material, mutation, ganon, and that's why very very specific ang 5 days mo lang gagamitin yung molnupiravir na yan. Hindi tatagal. Huwag mong gagamitin for prophylaxis lalong-lalo na kasi hindi natin masasabi kung safe talaga yung ginagawa na yan. And you don't want to give that to pregnant women either. So very, very important na these kinds of drugs, merong indikasyon ito, merong pinag-aralang duration, merong pinag-aralang safety profiles. We do not misuse them. Do not use them for prophylaxis because I think some people are using it for prophylaxis and that is not a very smart thing. Baka kayo yung maging variant. So, yun lang.
Okay, thank you, Doc Edsel. Siguro remind na lang natin everyone, the LCPG documents are actually available online. You can look through the evidence review that's been done by a whole group of physicians and healthcare workers who are experts in evidence review that's being led by Doc Isa with several other physicians din po. No? So make sure lang natin na nabasa natin yung mga basis for why the DOH is recommending X, Y, or Z drugs. So siguro at this point, may question kasi on what approved pills are there. I'll just summarize it. No? So there's an EUA for casirivimab plus imdevinab. There's an EUA also for molnupiravir. And then there's CPR already for remdesivir. And all other medicines are under CSP. No? So kapag CSP po, so individual na sa hospitals yung kailangan kunin yung, may kailangan kayong i-fill up na forms for this. So yun yung summary natin. So with this, we are We know that ang dami na rin sinagot ng experts natin over the Q&A. So we thank everyone for your active participation and for allotting time to be with us today to learn about the updates in our PDITR guidelines. So at this point in time, before I call on our experts to do their final messages, maybe we'll start with Yusek Rosette first. Yusek?
Thank you, Director Bev. Maraming salamat po, of course, sa ating mga experts, si Dr. Edsel, Dr. Ana, Dr. Isa. Kung gusto ko lang hong ipaalam sa lahat ng ating mga healthcare workers, from day one po na nag-umpisa tayo ng response dito sa pandemyang to, kasama na ho namin ng Technical Advisory Group of Experts, si Dr. Isa, si Dr. Ana, at si Dr. Edsel. Sila po lahat pro bono, no? At tumutulong lang ho para sa serbisyo sa bayan. So nagpapasalamat po tayo ng marami sa kanila. They have guided all the policies for our COVID-19 response. And for that, we thank them. So ngayon po, nagpapasalamat naman kami sa inyong lahat sa pakikibahagi niyo po dito sa Town Hall kung saan natalakay po natin ang kahalagahan po ng patuloy na pagpapaigting ng ating prevent, detect, isolate and quarantine, test, reintegrate strategies at ang ating mga lokalidad at komunidad. Kasabay po ng ating pagbabakuna at unti-unting pagbubukas ng ating ekonomiya, mas kinakailangan po natin na magkaisa upang siguraduhin ang maayos at walang tigil na pagpapatupad ng ating PDITR. Ang ating PDITR strategies ay pinapatupad upang epektibo po nating mabantayan at mapigilan ang pagkalat ng COVID-19 sa ating bansa. Muli, pinapasalamatan po natin ang ating mga eksperto and of course sa pagbabahagi po nila ng kanilang mga expert opinion, recommendations, inputs. Sinagot pa po ni Dr. Ana lahat ng mga questions sa chat box. Maraming salamat po Dr. Ana for doing that so that we can provide more information and response to our healthcare workers. Sa pagkakataong ito po, muli niyo po akong bigyan ng pagkakataon para bigyang diin ang ating key messages sa ating talakayang ito. Una, lubhang pinababa po ng mass vaccination ang tsansang tamaan po tayo ng malala na COVID-19 o maski ang maaring dulot nitong kamatayan. Ang atin pong mga polisiya sa pagtetest, sa pagka-quarantine at isolation ay atin pong ina-update depende sa impormasyong meron tayo para rin tayo magkaroon ng favorable risk-benefit ratio. Secondly, sa presensya ng mas nakakahawang variant na Omicron, mas kinakailangan po natin na gumawa ng mga naaangkop na pagbabago upang masiguro natin ang pagkakaroon ng health at iba pang essential services sa ating bansa. Ikatatlo, mayroon po tayong mga bakuna na makakapigil sa malalang tama ng virus. Gayun din po, may mga gamot na rin para sa mga mas mapanganib, pati na rin ang mga hindi pa bakunado ay mabibigyan natin ng mga gamot na ito. Ikaapat, kahit po tumataas ang bilang ng mga kaso, pinapakita po ng siyensya na ang bakuna at ang mga katangian ng Omicron variant ay hinahayaan tayo na una, paikliin natin ang isolation at quarantine period. Pangalawa, para kailanganin na lamang ang testing kung hinihingi po ito ng doktor. At pangatlo, gawin po nating optional ang testing kapag ang mga kilos ay magiging pareho lamang naman po maski ano ang maging resulta ng ating mga test. Gayunpaman, kahit mas maikli ang infectivity ng virus at mas banayad ang tama nito para sa mga bakunado at boosted, kinakailangan pa rin po nating sumunod sa minimum public health standards para maiwasan ang transmission, para rin maiwasan ang pagkakaroon po ng iba pang variants in the future. Taus-puso po ang pasasalamat sa lahat ng healthcare workers na nananatiling tapat sa kanilang sinumpaang tungkulin at nananatiling buong puso ang serbisyo para sa ating bayan. Sa labang ito, simula pa po noong unang pagdating ng COVID-19 sa bansa, kayo po ang aming naging lakas. Maraming salamat po sa inyong lahat. At makakaasa po kayo na patuloy na pag-iigtingin ng kagawaran ng kalusugan ang ating mga stratehiya upang maproteksyonan po natin ang ating komunidad kung saan kayo ay nabibilang. Muli, saludo po kami sa inyong lahat at naway patuloy po kayong gabayan ng ating may kapal. Muli po, nananawagan din kami sa lahat ng lokal na pamahalaan na siguraduhin po natin ang ating mga pulisiya ay maayos na maipatupad sa ating komunidad upang mas lalo pa ho nating makontrol ang COVID-19. Nananatili pong kritikal ang ating pagkakaisa kung nais po natin maging ligtas na malampasan ang pandemyang ito. Naway naging makabuluhan po para sa lahat ng naririto ang pagtatalakay na ating sinagawa ngayong araw at naway maging daan po ito upang mas maayos pa nating maisagawa ang ating mga response strategies. Maraming salamat po sa inyong lahat at mabuhay po tayong lahat. Bev?
Thank you very much, Yusek, for your message. At meron kasama ng review para sa ating lahat kung ano yung mga key points today. So with this, may I just ask our experts to say their final reminders po to our healthcare workers. I'll start with Doc Edsel.
Yeah, so thank you very much to everyone for attending. It's a lot of questions. Tapos Bev, mukhang may fans club ka na sa chat group. So, batiin mo naman from time to time. But anyway, seriously, the science is changing so fast. And yung Omicron talaga parang kumbaga it's really forcing the issue to the point na dati magko-contact tracing tayo, may 3 araw tayo bago maging infectious ang tao. Ngayon 1 araw. So kino-contact trace mo pa lang yung isang tao, nanghahawa na yung contacts niya. So, it's not something that is sustainable. In the US, 1 million na yung mga patients every day. So we have to change our strategy. But the biggest thing that we have, that we didn't have in 2020, is vaccination. And so, pag nabakunahan na natin karamihan ng tao, then COVID does not hold as much terror for us compared to the start in March 2020 na lahat tayo takot na takot, di ba? Pero ngayon, meron tayong laban. And I think that as this evolves, we are learning better and better to cope with this virus. And we have to move forward. So hopefully, this will mark a new shift in the way that we deal with this virus as we learn to live with it. And as long as we vaccinate as many people as possible, I believe we will be okay. Thank you po.
Thank you, Doc Edsel. Doc Isa?
Thank you, Bev, Yusek, and thank you to all our healthcare workers who joined us this evening. Thank you for all the questions that you've raised. These are all important questions, and we hope we have clarified the shift in policies. And as Edsel stated, because the science is evolving, so we need to be able to adapt to the evolving evidence. So we are all in this together, in this fight against this pandemic. So we need to continue to work in solidarity, fighting this pandemic and the infodemic. Kaya we need to be science-based, continue to be science-based in our decision making, okay, and timely also. Kaya we have the Living CPG. So if you need guidance, we are continually updating the Living CPG, and you can access that at the PISMID website and with links also at the DOH website. Okay, so I think it's important that we continue to be open-minded, and think we're moving now to, it's 2 years now into the pandemic, and I think it's really probably food for thought for us already to think about really living that COVID virus is part of COVID-19 disease is part of our differential diagnosis already. So as we do our history taking and physical exam, that's part already of our differential. So it's moving towards really that it's an endemic disease. Well, it's part of the endemic disease already, and the vaccines is one of our armors against it, and even the vaccines are also evolving. It's being reformulated. So parang kagaya ng flu, di ba, every year we need, it has to be reformulated. It might be that way, so we continue to be updated with the science. So, and I also enjoy if you can participate also in clinical trials in research that contribute to what we know. So that's also a call for our healthcare worker trials researchers to also participate in this, so to support this. So that's it for now. Thank you really everyone for all the work, important work that each and every one of you is doing.
Thank you, Ma'am Isa. Doc Ana.
I'm really glad to have this chance to address fellow healthcare workers and to have the opportunity to listen to your concerns and address your questions. I think nung nagsimula yung pandemic, ang naging response natin has been anxiety, worry, kasi lahat tayo hindi talaga natin kilala tong kalaban natin. Ngayon, medyo mas hindi na tayo gaano nag-aalala kasi mas marami na tayong nalalaman at natutunan tungkol dito sa sakit na to. Pero ang kalaban naman natin ay pagod. I think all of us have this same feeling na hindi na ba ito matatapos. Kala natin pababa na yung mga kaso tapos meron na naman tayong bagong kalaban. Pero siguro I'd like to pick up from what Dr. Isa said na sama-sama tayo, and isa na dun sa mga ginagawa nating aksyon para makasiguro na lahat tayo makapagtulungan is to learn from what the science is telling us about this virus. Mabilis siyang kumalat, mabilis siyang makapanghawa, kaya dapat mas mabilis pa ang kilos natin. So, paradigm shift talaga yung sinasabi natin ngayon. Hindi na test, treat, isolate. Baliktad na siya, di ba? Isolate, treat, and maybe test. And with that, sana kung kahit yun lang ma-implement natin, sa tingin ko marami na tayong mababawi in terms of exposures within the healthcare sector community and also in the larger community. And hopefully with that particular paradigm shift, mas mabilis natin makontrol itong panibagong surge na ito at medyo gumaan-gaan din naman ulit yung ating hinaharap na trabaho sa pang-araw-araw. So, I just like to wish everybody a safe weekend na ba? Parang feeling ko Biyernes. Biyernes na nga ba? So it's been a burdensome week. So sana lahat tayo we all take care and keep safe. Maraming salamat.
Thank you very much, Doc Ana. So yun po, maraming salamat. I just have a few slides to share with everyone. Tech team. Okay. Thank you. Next slide, please. We will next. Yes. Okay. So we will make sure that all the updated resources will be both in the DOH website, but we also recently launched the Healthy Pilipinas site where you can download most of the resources. So just go to healthypilipinas.ph and you will see this at sa taas may tab doon na COVID-19 resources. So mapupunta kayo dito sa yellow na page ng Vida Solution wherein all of the downloadable materials that you can give to your patients can also be accessed here. Next slide, please. Next. So we also, mental health is such a big issue, not just for our patients, but for many of our health workers. So we've also recently launched with the help of our partners in USAID, the Lusog ESIP app. If you're familiar with some of the Western apps like Calm, or Headspace, so we did one version for Filipinos. So it's good for anyone over 18 years old. It's free and downloadable from both Google Play and Apple Store. So hopefully you can use this for yourself or for your patients. Next slide, please. All right, and finally, we just like to plug our Kira chatbot, which should be appearing in your Viber prompts or also in your Facebook. So you can actually ask your patients to ask certain COVID questions in this through this chatbot. So medyo nakasagot po kami ng medyo marami-raming tanong. Next slide, please. So finally, we just like to thank everyone for taking part in our Res Bakuna Kasangganang Bida campaign. Marami na sa atin, almost all of us health workers are vaccinated and hopefully get ourselves boosted ASAP. But yung kind request namin sa inyong lahat, we need to flood the airwaves with stories of success of the vaccination, of how it has protected real people, real healthcare workers, and even our patients, our families. So just feel free na mag-upload ng mga kwentong Res Bakuna and use the hashtag kwentong Res Bakuna. Hopefully, we will be able to pick them up and make sure that we send you an invite to be interviewed as part of our media fora and some of our other events, because we are really curating these good stories to convince those who are still not yet convinced to actually get vaccinated. So please remember, mag-post kayo and then just use hashtag kwentong Res Bakuna and we will be picking up stories from there. So yun lang po. With that, maraming salamat po to almost 2,500 people who joined us today both on Zoom and on Facebook. And rest assured that we will use this channel to continuously update everyone on our new developments. So please take care and stay safe, everyone. Maraming salamat po on behalf of the Department of Health.
Res Bakuna na! At may kasangga na ang ilang bida ng ating bayan.
And I feel good. It's a big boost for us.
I feel relieved. Tagal nating inantay to, so why hesitate now?
I feel very happy that we can finally start to put an end to this pandemic.
Res Bakuna, kasangga ng bida. Sama-sama tayo sa Bida Vaccination.